We are discussing the kidney diseases which is leading to the hematuria. So we have discussed malignancy, pyelonephritis and non-glomerular causes. Now glomerular diseases which are leading to the hematuria. So immunoglobulin A nephropathy. This is a glomerulonephritis which, as the name indicates, it is due to deposition of immunoglobulin A immune complexes in the mesangial cells of the glomeruli, and it leads to proliferation of mesangial cells and often resulting in hematuria, edema, hypertension, and it may lead to reduced renal function and other symptoms of progressive kidney injury. So as the name indicates, immunoglobulin A nephropathy, deposition of immunoglobulin A immune complexes. The next one is membranoproliferative glomerulonephritis. Membranoproliferative glomerulonephritis. This is also a glomerular injury, but it is due to deposition of immune complexes and or complement factors in the mesangium and capillary walls. It is resulting in mesangial cell proliferation and capillary wall remodeling. So it is the membranoproliferative, as the name indicates, membranoproliferative, deposition of immune complexes and or immune or complement factors leading to the mesangial cell proliferation and capillary wall remodeling. The other one is post-infectious glomerulonephritis. Post-infectious, or we can say is most commonly due to streptococci as a post-streptococcal glomerulonephritis. This is a glomerulonephritis due to an immunologic kidney response following non-renal infections, and this is most often associated with streptococcal infection, but it may be caused by other types of infections. Post-streptococcal glomerulonephritis or post-infectious glomerulonephritis. Then Good-Pasture syndrome. This is a combination of diffuse alveolar macrophages, rapidly progressive crescentic glomerulonephritis, and anti-glomerular basement membrane antibodies. Some authors use the term Good-Pasture syndrome to describe the combination of severe glomerulonephritis and lung hemorrhage, regardless of etiology. And some others use the term Good-Pasture syndrome for the patient with anti-glomerular basement membrane antibodies. So basically it is a combination of diffuse alveolar hemorrhages with rapidly progressive glomerulonephritis. Then Alport syndrome. Alport syndrome, it is the genetic disorder and it is characterized by hematuria, proteinuria and progressive renal failure and sensory neural deafness. So when we are asking about the family history, so we'll have to think of Alport syndrome as well. Then hemolytic uremic syndrome. Hemolytic uremic syndrome. So this is a triad of non-immune microangiopathic hemolytic anemia, thrombocytopenia, and acute renal failure. This is most commonly following the infection with E. coli and Shiga toxin. We call it Shiga toxin produced by E. coli, and this may occur following other bacterial infections, just as Streptococcus pneumoniae. About 5 to 10% of cases of hemolytic uremic syndrome are classified as typical and not caused by Shiga toxin producing bacteria or streptococci. Atypical hemolytic uremic syndrome caused by dysregulation of complement system. So the bottom line is, it is the hemolysis, so hemolytic anemia, and combination of thrombocytopenia and acute renal failure. So these are the glomerular diseases or the glomerular causes of hematuria. Then we move on to the kidney diseases, vascular diseases. So if you take the renal artery, so stenosis, thrombosis, embolism. And if you take the renal vein, thrombosis, entrapment. Entrapment. Then arteriovenous malformation, malignant hypertension, and sickle cell disease.